Hi, Dr. Greg Pat here again from PT Made Simple. Today we're going to do a quick 5-minute shoulder workout with just using a TheraBand. So all exercises using a TheraBand or any kind of resistance band that you have. TheraBand is just a brand name. Any kind of resistance band will do. Normally what I would have patients do at home would be to attach it to a banister or a column. I'm just going to attach it to the side of the table here. But any kind of a doorknob, usually a door would work best for these kind of exercises. So I have 7 exercises that we're going to go through today that's going to target the entire shoulder complex to get you a nice bulletproof, nice strong shoulder. So we're going to do a banded internal rotation, banded external rotation, banded abduction, banded flexion, banded row, banded extension, and then banded bilateral shoulder external rotation. So we're going to start, it may not be in the exact order there, but what we would do first is I'm going to show you, and again, I may switch arms between treating my left and my right arm, but you could just do both arms if you want, or just your side that's you really want to focus on. So I'm going to start with banded internal rotation. I'm going to be doing that for my left arm. And I like to have a towel underneath the arm. Just kind of keep that squeeze. It helps technique and increases the muscle activity. So starting, what I'm going to do is you're just going to kind of pull. So if this is attached to a door, works best. Ideally, if the anchor was a little bit lower than elbow height, that works best. But if it's at the doorknob and that's about elbow height, then that's fine. So we're going to do 15 reps. I may not do all 15 now. So just starting in, pulling towards your stomach, coming out slow. Pulling in, out slow. You're not rotating the arm. Shoulders are kind of staying pinched. Stomach's nice and tight. Gonna do 15 like this. Then we're gonna switch. And if I was gonna stick with my left arm, I would have my back to the camera. And we'll go that way. But for convenience sake, I'm gonna switch this here. I'm just going to show you on my right arm. So now you're going to start in a little bit and you're going to pull out. Good thing with the band is you can step further out if you need more resistance, or closer to where it's anchored if you need less resistance. But again, if we're doing 15 reps, you want the last from 11 on to be pretty challenging. Again, no painful, but like you're getting a good workout. And usually pulling out is harder than pulling in. Not for everybody, but typically it is. So this is the banded external rotation. And I'm going to have to move the band lower to do the abduction and flexion. So I'm just going to show you the row and the extension first. So the row, what you would do, out straight, you're just going to kind of pull back. Really call it retracting the shoulder blade, pulling it back, keeping that pinched. You're not pulling up like this, you're not pulling down like that. Your elbow's kind of staying in a nice 90-degree angle. And if you had a flashlight in your hand and you're pointing straight forward, it would point straight forward. The light wouldn't shine up towards the ceiling and it wouldn't shine down towards the floor. Your hand, you can see, is really only coming about to the stomach. It's just pulling that shoulder blade back. If you had 2 bands, you could do both at the same time. But I'm just showing you with the 1 band here. 15 like this. The next one, banded shoulder extension, is now the elbow is going to stay straight, up nice and tall. And you're going to pull straight down. Hand pulling down towards your hip. Still pinching that shoulder blade back. We're going to do 15 like this. Get up nice and tall, stomach nice and tight, pulling that shoulder blade back, elbow staying straight the whole time. And this is the banded shoulder extension. And then after that, So you can use that for a doorknob for all 4 of those exercises. If you're using a door, again, that probably works best to do the abduction and the flexion. What you would want to do is put a knot in the band and put it underneath the door and then close the door so a knot kind of gets caught. I'm just going to attach it down here underneath the table. And the first one is going to be banded abduction. So I'll show you from my right arm what you would do. Arm by the side, trying to come up to the side. 15, just like this. Going out to the side. You don't have to come all the way up because then the band kind of loses its effect. Just a little bit past 90 degrees. Or right to 90 degrees. Again, if you ever need more resistance, step further away. If you ever need less resistance, step closer. This one is a little bit harder. Ideally, if you have bands and have different resistances, you may be able to do green for some, and you may need to do red or yellow for others, and or maybe even blue for some. So this is showing you with one band, but if you have multiple bands, you can just set up to make it nice and easy. That's shoulder abduction. And then I'm going to show you from my left arm for shoulder flexion. Just trying to come straight up. Again, just about hand even with the head. You don't need to come all the way up because you're going to lose the effect of the tension on the band. 15. Just like this. This is the shoulder banded flexion. And then the last one, the banded bilateral shoulder external rotation. This one, now the band is loose, not connected to anything. Both arms kind of glued by your sides, elbows stuck to your sides, and you're just going to pull out. And as you're doing that, you're pinching your shoulder blades together. So as you're pulling out, pinch those shoulder blades together. And doing 15, just like this. So, you do all 7 of these exercises, you're going to have nice, strong shoulders. You're going to strengthen the rotator cuff, the deltoid, all the muscles involved in and around the shoulder, around the scapula. So you can get nice, strong shoulders, prevent any shoulder injuries in the future. Or if you're rehabbing from a shoulder injury, good exercises to do. Again, if you just had surgery, rotator cuff surgery, there's some exercises that your physical therapist may not want you to do, so always check with the physical therapist before starting these exercises. But for the most part, if you haven't had surgery and you just want to get big, nice, strong shoulders, these 7 exercises are great to do. And look, it took us 5 minutes, maybe less. So if you do that a couple times a week, you're going to get nice, strong shoulders. So leave any comments below if there's anything else you guys want to see, but thanks for watching.